Hi, it's nice to have you back in our office, and I hope you had a wonderful checkup with your doctor. And I believe you did have some questions regarding medication intake, and I'm just going to go through that real quick. Last week we talked about those wonderful things that would be good for your body and the baby, and now we're just going to go through some precautionary measures during your pregnancy journey. Okay, and I have a packet as well for you to bring home for reference. All right. So throughout this pregnancy, there are certain precautionary measures that a pregnant woman needs to be mindful of, especially things to ingest. Remember, anything that goes into your body affects the baby greatly. So now let's go to the very most important one, which is food. So seafood is great for the baby's brain and eye development, as mentioned last week, right? It's in your packet as well since it contains that omega-3 fatty acid and the protein content. But also be aware that the older the fish gets, the higher the mercury content, which is dangerous for the baby's development or the baby's developing nervous system. Okay, so during pregnancy, it is safe to eat at least 2 to 3 servings of fish like tilapia, cod, canned tuna, catfish, trout, and even shrimp. Okay, so for now, if you're into Japanese food, we may need to avoid or steer away from those undercooked food or raw food such as sashimi. Okay, those undercooked meat and poultry, since you may be at high risk for bacterial food poisoning, which affects the baby as well, definitely. Okay, so going to your concern, those over-the-counter medications and supplements. General rule, it would be good to check with your doctor first before taking any over-the-counter medications, okay? Let's try to avoid this during the first trimester, which is during the 12 to 13 weeks of your pregnancy, since the baby is at highest risk at this point. Excuse me. So no aspirin, definitely, unless told to do so. And let's stay away from those non-steroidal anti-inflammatory drugs, also called as NSAIDs, all right? This would be naproxen, also called as Aleve, and Advil and Motrin, which are ibuprofen, since this can cause heart defects for the baby, okay? Acetaminophen or Tylenol is okay, is safe for short-term use for pain relief. And try not to take, in general, try not to take too much medication since it is not good for the baby. All right. And our very favorite, us women, retinol and vitamin A. Too much can harm the baby's development. For that one, vitamin A or retinol, you know how we love it um, topically, and I'm not just talking about ingesting it orally, but topical use as well. Let's steer away from that for now, okay? And you should also avoid those liver products, including fish liver oil, since they are also high in vitamin A. Okay. Well, if you are into gardening, we would want to hold off on that for now. Just be cautious of those chemicals being used in the garden, okay, such as pesticides, all right? And we are talking about environmental exposure right now. Those flame retardants on furniture, lead, mercury, and some cleaning products. Be cautious about using those in inhaling it or having it on your skin. Okay. So the fetus is particularly vulnerable to environmental chemicals that can disrupt its developmental process during these critical times. So during pregnancy, these hazardous chemicals have been found in cord blood, placenta, and even breast milk. Okay? All right. So now let's go to substance abuse. Okay? I'm going straight to the point by saying alcohol use is in the first 3 months of pregnancy can cause great harm to the baby. This can cause those facial feature abnormalities, which is also called the fetal alcohol syndrome. All right, the baby can be at risk for growth and central nervous system problems such as low birth weight or behavioral problems. Okay, so illicit drug use during pregnancy is a no-no. All right, it causes numerous amounts of problems such as miscarriage, preterm labor, birth defects, stillbirth, withdrawal symptoms in the baby after birth. All right, and it causes a higher risk for sudden infant death syndrome or SIDS. We have the poor fetal growth and cognitive and behavioral problems. So that seems a lot, right? And not just the baby, but for you as well. Okay. So let's try to stay away from that. All right. And during pregnancy, we've been asked this so many times here in our office, can we travel? Yes, you can, but you have to be cautious about certain things, be mindful of certain things. So if you're pregnant, the safest time to travel is during the second trimester, provided that you're not experiencing any complications. So definitely check with your doctor first as well before traveling. Okay. And if you're pregnant and considering to travel, you must consult with your doctor, especially if your pregnancy is at high risk. Okay. Another risk that we need to talk about is DVT, that deep vein thrombosis, which is increased in pregnancy because of the body changes that it's going through. So DVT is when a blood clot is formed under a deep vein. Okay. And if you're on board the aircraft, stretch and move your legs regularly while seated, and consider wearing support stockings for the duration of the flight. So your circulation is already under strain. The lower the cabin pressure inside the plane can theoretically increase the risk for this DVT or this blood clot. Okay, so avoid traveling to developing countries, developing nations during pregnancy. So be mindful of taking medications of any kind, including those commonly used for to treat travelers' diarrhea. Okay, those medications again. All right. The important exception to these medications is the influenza vaccine, which is can be safely given during pregnancy. So it is strongly recommended for all pregnant women to get this vaccine since influenza in general can be a very serious illness. But be mindful of generally all those live vaccines, such as mumps and measles, should be avoided during pregnancy. Again, consult with your doctor, okay? So another thing that the ladies usually miss out because of everything that's happening in their body is the dental care. Okay, dental care is very important during pregnancy due to these hormonal changes. Okay, so the safest time to check with your dentist is during the second trimester. The third trimester is okay, but sometimes we see that it is, or they say that it is difficult for women to stay in that sitting position because of the physical aspect during that time. All right. So, in fact, some experts believe that there might have been an association between periodontal disease and poor pregnancy outcomes, such as preterm birth and preeclampsia, that hypertension condition that we talked about last week. Yes. So, local anesthetics, if needed, are safe, such as lidocaine. If anything stronger is needed, this can be discussed with your primary, okay? And another concern that we get is X-ray, all right? X-ray has very little risk to the fetus. Just make sure that you advise the X-ray staff that you are pregnant so they can advise them again, all right? So they can shield your abdomen and the pelvis area from exposure, okay? And I'm going to repeat when it comes to pain control. Acetaminophen combined with narcotic drug is safe to use for short term and avoid opioid dependency. Okay, those NSAIDs, such as the non-steroidal anti-inflammatory drugs, again like ibuprofen, are not advised. Okay, again, I cannot stress enough. Call us, call your doctor, ask. Okay, there's no harm in asking before ingesting anything. And I'd like to thank you again for your visit, and I hope to see you next week. Have a great day.